Hi, I'm Cecilia Gambala. I am a maternal fetal medicine specialist. So prenatal care is the care for pregnant women, which was first started in the mid-20th century. The focus was looking at preeclampsia, which is a disease in pregnancy, which finds blood pressures to be very elevated and some poor outcomes. When they looked at this, they saw that more frequent clinic visits could identify the disease earlier with earlier management and better maternal and neonatal outcomes. So by mid-20th century, prenatal care was established and provided to all pregnant women so that there were better outcomes. Without prenatal care, we are not able to identify these complications early, such as preeclampsia, as mentioned, which is a hypertensive disease, or gestational diabetes, or for the fetus, seeing that there's any kind of genetic abnormality or structural defect, or even fetal growth restriction. Without prenatal care, these processes and complications would not be identified, and this may lead to both maternal or fetal death. Prenatal care is provided by any person in the healthcare profession that is skilled in obstetric care. This could mean a certified midwife, this could be a RN or NP. This could also be physicians that are trained, such as family medicine physicians or the obstetrician and gynecologists. Prenatal care includes counseling about different genetic disorders which may be inherited from the mother based on her genetic history. So some of the tests that are required early in pregnancy would establish whether or not the mother is a carrier for any of these genetic disorders that she can pass on to her infant, or if she has an active infection in any of those communicable diseases, or if she has previous immunity from vaccinations or previous infection. This will let the obstetric provider be able to counsel the patient on potential risks or complications to the pregnancy. So depending on the trimester, the visit can be a little bit more involved, but within each visit, we will be definitely weighing the mother to see how much weight she's gained, making sure that it's appropriate, not too much, not too little. We'll be checking the blood pressure to make sure that the blood pressure is in the normal range and that they're not developing a hypertensive disease like preeclampsia. We'll also be checking their urine with every visit. There are increased risks for urinary tract infections when a woman is pregnant, and she may not even know it. And then last but not least, but of course, when we can, we will check with a handheld instrument to hear the baby's heartbeat, and usually that starts around 12 weeks of gestation. Fortunately, in the United States, we have created a law that allows for every pregnant woman, regardless of race, regardless of immigration status or citizenship, they are all able to receive prenatal care in any of our hospitals or clinics. That being said, however, some women don't realize this or feel that they have to apply for it, have difficulties, and there are still safety nets in which any hospital or emergency room is required to take care of our patients. Usually once they're found in this space to be pregnant and not have any insurance, we direct them towards the appropriate resources. A woman should seek prenatal care as soon as she realizes that she has missed her period and confirms a positive urine pregnancy test. The reason you want to establish prenatal care really early is, most pregnancies, believe it or not, are not planned, and some women are not quite sure when their first day of their last menstrual period is. This date is very important because it helps us understand how far along the pregnancy is. So seeking care early will help establish how far along a pregnancy is and what type of management needs to occur. So spotting during pregnancy can be considered normal in certain circumstances. For instance, early in pregnancy, sometimes women feel spotting when they're having early implantation of the placenta. However, sometimes they can also experience spotting after intercourse, because that's a natural process when there's a little trauma to the cervix, which has increased vascular supply and circulation during the pregnancy. However, spotting in general could also mean early preterm labor. It could mean signs of early infection. It could also mean that the placenta's in the wrong place. So it's really important that when a woman experiences spotting during pregnancy that they call their provider and get early evaluation. So hopefully when you start to experience signs of labor, you're already full term, and that is when you're approximately 37 weeks gestation. Anything before that would be considered preterm. So the signs that you're looking for are regular contractions, contractions that tighten the abdomen at the very top when the baby's full term. Some women call it tightening of the baby, or the baby balls up. You know, be mindful of whether or not you can feel your uterus in your belly and it's hard as a rock. If you feel that contraction, and that contraction would make you stop talking or double over, that is a very good contraction and will likely continue. Labor would be these types of contractions every 10 to 15 minutes that will not go away even if you relax and rest or have a nice glass of water to see if they'll go away. Those types of contractions will eventually continue, and if they continue for 2 hours, then you're definitely in labor. Whether it's early labor or full active labor, it would be a time to be seen in the emergency room. Other signs of labor include your bag of water rupturing. If your bag of water ruptures but you're not feeling the contractions, it's still really important to go ahead and be evaluated in the hospital. Some women start to feel their contractions, but some women may take hours before their contractions come. But it's really important, since now the bag of water is ruptured, you know, the connection or the protection from the environment that your baby had from that membrane is no longer there, and you really should be seen in the hospital. Another sign of labor is the famous bloody show. So the bloody show is what is read about, or you might see in movies, and that's where a woman looks down or reaches down and there's a whole lot of blood. That doesn't always happen, really. In fact, it's a little bit more mucousy, so a little bit yellowish tinge, and maybe like streaks of redness. But that could be signs of your cervix starting to open. And so you may see the bloody show, but it doesn't have to be a bloody show. So in the city of New Orleans, there are many different women's health clinics that are available, whether they're backed by an academic institution like Tulane or LSU or Ochsner. In addition to these academic institutions or affiliated institutions, there are freestanding clinics like Crescent Care or Daughters of Charity, and many more, including Planned Parenthood, who can identify pregnancies early but then direct the patient to other clinics that provide more regular prenatal visits.
Thank you for watching. Check the playlist for additional videos.